السادسة يعني. This is the last session، ونرحب بدكتور ياسر ودكتورة مهجة، وما أعرف معانا أساتذة تاني ولا لا. أنا ما شفت البارتيسيبانتس عشان نرحب بهم. آه على كل حال بنفتح.
البروف قاعد
بروف فتح العليم، ما شاء الله، ما
يا
شاء
مرحبا
الله.
أهلا.
ولا؟
مرحبا يا بروف، نورتنا.
أهلا
يديك
بكم.
العافية.
مرحبا يا
أهلا
بروف.
أهلا
تمام.
ياسر، مرحبا غالي.
كيف اموركم؟ ان شاء الله كويسين.
الحمد لله، بارك الله فيك.
يا شباب وشابات، بروف فتح العليم حاضر معانا، ما تكسفونا الليلة. يلا
ايوه.
هنفتحها، المجال مفتوح، حتى لو زول عمل قبل كده وعايز يعمل تاني يعمل، ياخد كيس، ياخد الكيسة الأولانية.
يلا،
anyone.
افتكر عندنا
طوالي كده.
لوسي اخر حاجه ما عملناها.
لوسي ما اتعملت، خلاص نشوف لوسي. طيب، أنا بخلي الميكروفون ليك يا ياسر، أنت ومهجة، وتفضلوا.
عايزين فولنتير. وبعدين احنا طولنا من الاس بي اي، يعني متوقعين اول كيس ما تكون يعني as smooth as it used to be في الاخر، لكن عادي، ده المتوقع عادي. وبعدين يعني هنا شويه شويه الناس بترجع تاني. يا جماعه فولنتير.
يلا يا شباب نختار.
لو في واحد اسمه محمد، خليه يبتدي.
البروف قال لكم لو في واحد اسمه محمد يبتدي. يلا نشوف محمد.
عندنا محمد، ثلاثه محمدات: محمد عبد الله
آه
التوم،
كلام
محمد
البروف
احمد
ده ما
طه،
بينزل.
ومحمد طارق عثمان،
أنا
بس
محمد.
ومحمد
يلا.
جلال. أربعة
محمد
محمد.
تومي يبتدي طوالي، وبعده محمد طارق، وبعد ذاك محمد. يلا، بسم الله.
دول
محمد معانا.
حيكرهوني شوي.
محمد التوم. محمد، افتح الميكروفون.
Yeah. Hello, Professor. I'm already here. And
أوكي.
yeah, I presented before, and I would like to give the chance to someone else from other Muhammads.
قلنا من جبال قلنا ما في مشكلة، ممكن حتى لو جول قدم قبل كده ممكن يقدم يا محمد إذا عندك الرغبة يعني.
Yeah, I would like to give the chance to someone else if it's possible.
أوكي.
محمد أحمد طه.
محمد.
محمد أحمد طه.
أمم.
شكله كده
افتح
حنشوف
الميكروفون.
البنات.
محمد أحمد طه، افتح الميكروفون.
أيوه.
وعليكم السلام ورحمة الله. محمد. محمد معانا.
أظن عنده مشكلة شبكة يا ياسر، افتكر
شكله
كده.
شبكة ضعيفة. عليكم السلام.
لا 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 لا،
طيب،
هي كام.
شوف زول شبكته كويسة.
محمد طارق.
السلام عليكم ورحمة الله.
وعليكم السلام ورحمة الله. محمد.
Um, okay, I can try إذا ما في دول. أنا actually عندي ملاريا وكنت actually planning to listen عشان أستفيد، لكن if no one is willing to volunteer can go ahead إن شاء الله، ما في مشكلة.
سلامات يا أخي، سلامات، ما تشوف شر.
عليكم
الله
السلام.
يسلمك يا بس. Okay.
شبكتك كويسة؟
إن شاء الله بإذن الله.
عين،
إن
we're
شاء
gonna
الله.
take it easy. في الآخر ده ما امتحان وما اختبار ولا أي
أي
حاجة، ده ما امتحان.
ولو ويا محمد، لو في أي لحظة حسيت إنه يعني زول تاني بيواصل بدلك، يعني you don't take the whole case لو لقيت فيها مشكلة.
إن شاء الله
شكرا
بس.
لك. شكرا لك.
تمام.
شفاك الله.
سلامات كده، ما تشوف شر. غايته حنبتدي، وانا will walk you through the process. حنعمل لكم reminder للاكسبكتيشنز وشوف الحاصل شو. خلاص. يلا. The case of Lucy Golding. A scenario, information. Lucy Golding is a 30-year-old woman who has recently been brought to the emergency department due to a sudden inability to move her right arm. The medical team, including a neurologist, has evaluated her and found no medical explanation for her symptoms. Lucy's sister mentioned that Lucy has been under significant emotional strain lately, leading to the medical team to believe a psychiatric evaluation might be beneficial. Your task is to engage with Lucy and gather detailed psychiatric history. It's a very classic psychiatric history. في الآخر حتكون غالبا أنا ما شفت الكيس لكن أتوقع حاجة between 15 to 20 minutes. It's a very يعني هنا psychiatric assessment. اللوكيشن حقتك ما الأوفيس، اللوكيشن حيكون الإمرجنسي. والفوكس ظاهر انه اوكي في ستريس وظاهر انه في فيزيكال سيمبتومز. لو نتكلم على سوماتيزيشن ده اللي هو كان التوبيك بتاع الاسبوع اللي فات.
حاضر.
طيب البري ريدنج ماتيريال اللي هي في الاخر فيها حبه يعني انفورميشن عن الحاجات اللي هنشتغلها، لكن في الاخر في نوع من الاسئله ذاته موجوده هناك اللي هو الاي سي دي 11 guidelines. Conversion disorder is classified under dissociative neurological symptom disorder, characterized by symptoms that suggest a neurological condition but are not explained by a medical or a neurological condition. It is essential to note that these symptoms are not intentionally produced. لأنه لو intentionally produced بنتكلم عن malingering. Dissociative disorders involve a disruption or a discontinuity in the normal integration of consciousness, identity, emotions, perception, body representation, motor control, and behavior. These can range from amnesia to identity disturbance. Nice guidelines. The National Institute of Health and Care Excellence emphasizes a multidisciplinary approach in the management of these disorders. Early diagnosis and intervention are crucial. Psychological intervention, particularly cognitive behavioral therapy, are recommended for treatment of conversion or dissociative disorder. It is advised to avoid unnecessary diagnostic tests and procedures once a thorough initial assessment has been conducted. Communication skills, information, engaging with the patient who have conversion or dissociative disorder require a thoughtful, empathetic approach. Here are the key communication strategies. Establish trust. اللي هي دي كلها حاجات في أي عيان. Begin by creating a comfortable, non-judgmental space with the patient. Trust is fundamental. Active listening. دي كلها في أي عيان. Pay close attention to the patient's words and nonverbal cues. This helps in understanding their experience and symptoms better. Empathy, acknowledge the patient's distress and impact of their symptoms on their lives. ودي قلناها انه الناس تعملها يعني you have to show it، لكن مثلا ما عمال على بطال. يعني you should show empathy and understanding. You should explain to this to the patient that it sounds like this is a very difficult situation for you. It sounds like you're dealing with a lot of stress. يعني حاجات زي كده انت you show understanding. Clear, simple explanation. Use language that is easy to understand when explaining diagnosis, procedure, and treatment. دي في أي عيان. Validation confirms اللي هو confirm that their symptoms are real and distressing, emphasizing that you believe them. في الآخر أنت you believe the distress. ما معناته إنه you agree with the etiology. دي كلها مختلفة. Questions to ask Lucy. دي اللي هي how to pay attention، وإذا عايز تكتب منها حاجات ما في مشكلة. Can you describe what happened when you first noticed you couldn't move your arm؟ اللي هو open-ended question عشان تاخد بداية الموضوع. أنت you have a focus. What brings you here today؟ اللي هي هقول لك أنا I was not able to move my arm and neurologist شافني وكده وكده كده. Did anything specific trigger the onset of your symptoms? Have you experienced anything similar before؟
Okay.
دي هي فوكس على الفيزيكال سيمتوم اللي هي جابت العيان، لكن بعد شوية انت your role is to explore any emotional and psychiatric history. Have you been feeling more stressed or anxious than usual lately? Can you tell me about any significant life event or challenges you have faced recently? How have you been coping with these stresses? بعد شوية انت you go with the medical معي؟
أيوه.
تمام. You go with the medical and neurological history. انت you need to exclude and to confirm a diagnosis أول حاجة انه this is يعني في الآخر إنها is not a real neurological condition. Have you had any previous medical or neurological illness? Are you currently taking any medications? Social and family history. Can you tell me a bit about your support system at home or at work? Is there any history or of similar or other psychiatric conditions in your family? Functional assessment. How have your symptoms affected your daily activities, work, or relationship? Have you noticed anything that improves or worsens your symptoms? هي في الآخر ما is an يعني it's a يعني it's a psychiatric history لكن with a focus على الليل الsymptoms اللي جابت العيان. Discussing their findings and treatment strategies. When discussing your findings and potential treatment strategies, summarize key finding. اللي هي ممكن تقول له just to summarize to understand what's been happening. You've been dealing with this for a long for the last period, and you've seen a neurologist. They were not able to like find any reason. You've been dealing with this. You've been dealing with this. You've been dealing with this. Is there anything I'm missing? اللي هي summarize. Explaining the diagnosis, discuss the diagnosis, the expectation. انه في الاخر بعد الهيستوري انت you discuss a possible diagnosis اللي هو conversion or the social disorder.
Okay.
هي انت هنا you have to try to use non-medical jargon بكلام مبسط and what seems to be happening and the symptoms real لكن ال causes behind that might be related to her emotional state and stress, and these are common. وعندها treatment. فدي هي in a simplistic language. Outline the recommended treatment and approach including psychological intervention like CBT. ممكن تشرح بالراحة هي what the CBT is about بالراحة من غير details. And stress the importance of supportive environment. Answer questions. Be prepared to answer questions from Lucy's sister. الله عندنا غير لوسي في زول هنا. Providing reassurance and clarity on the diagnosis and treatment plan. لما يكون معاك اثنين في الانترفيو you need to focus تبقى focus على الليلة انه who is the patient and who you're gathering the information from. اللي هو في الحالة دي غالبا العيان.
Okay. History is going to be taken from the patient.
Yeah.
And then I'm going to reassure and answer the questions. Assist صح كده؟
تنسى الكويستشنز بتاعت اي زول هي مينلي للوسي ذاتها لكن اذا السيستم موجوده وعندها كويستشن انت you can answer. هو دي with the assumption انه هي Lucy agrees in her presence. انت you have to ask for permission. لكن يعني this is an assume في situation برا انت you have to assume انه العيانه راضيه لما تكون موجوده. اوكي نبتدي؟
بسم الله.
طيب.
Hi, thanks for seeing me. Sorry, I don't think I caught your name.
I'm Dr. Mohammed. I'm the attending psychiatric resident. I'm going to see you today.
All right, Dr. Mohammed, thanks for coming by. I'm a bit shaken, honestly. I still can't move my arm, and no one's really explained what's going on. It's all a bit much.
Which arm that you have difficulty moving?
It's my right arm. I just woke up and it wouldn't move at all. I can't lift it or do anything. It's like it's just not there, really. It's not weak. It's just nothing happens when I try.
You woke up and you faced difficulty in moving your right arm. Am I right?
Sorry.
Okay.
Could you repeat that? I'm not sure I understood what you meant. Are you
faced
asking if I had any pain or other problems when my arm stopped working?
Yeah, exactly.
Because there wasn't any pain. It just
There
sort of
wasn't
stopped out of nowhere.
any numbness. Did you have any numbness or any tingling sensation in the arm that refused to move?
No, nothing like that. There's no numbness, no tingling, no itching. It just doesn't move. It feels normal otherwise. Just won't do what I want it to.
Okay, did this incident, did it happen before or this is the first time?
This is the first time anything like this has ever happened to me. I've never had any problems with my arm before. Not like
Okay.
this.
Yeah,
It's
I can
honestly
understand.
really frightening.
Yeah, yeah. Okay. So, did you face any
All right.
difficulties or any stresses, any new stresses in your work or home environment lately?
Not really, no. Work's been about the same. Nothing out of the ordinary. I don't work on a farm or anything like that, if that's what you mean. My home life is pretty normal too, apart from all this. Are you still there?
Yeah, I'm with you. I really appreciate that. I'm
Okay.
totally okay.
Sorry, I didn't mean to offend or anything. I just want to be clear so I can answer properly. This whole thing has got me a bit on edge.
Dr.
Are you still
Yasser,
there?
I think I'm having a sort of sub block. I don't know if I can continue.
ما في مشكلة يا محمد. ما في مشكلة. ممكن نبتدي من الأول تاني مع زول تاني يا ياسر، مش كده؟
دقيقة بس أنا أقفل الهناي وأعملها ثاني من الأول.
بعدين يا محمد يعني أنت بديت معاه كويس، لكن طبعا بعد ما شرحت لك احنا قلنا أي complaint يا محمد الديوريشن. For how long? When did it happen? For how long this has been? When did you discover this that you can't move your arm؟ مش كده؟ الديوريشن. ايوه، اي كومبلينت طوال بنسال من الديوريشن. When did it happen? How many days؟ لكن you did well، ومدام عيان يا اخي ربنا يشفيك ان شاء الله، ما في مشكله، خليك مستمع بس.
Truly apologize.
لا لا، كتر خيرك والله
ما
انك
في
يعني حاولت اساسا
ما
يعني
قصرت
شفتها.
ما قصرت
يعني ما
ما
قصرت
قصرت.
نهائي. بس حاجه قبل ان ابتدي بالزول اللي بعده. دي ادفايس قلناها زمانك وطولنا من الموضوع ده. بالذات في الهناي في السينفلو ده، لو العيان يتكلم ادوه فرصه، ما تقاطعوا بعض، لانه لو قاطعتوا بعض ما حتسمعوا حاجه وفي الاخر الموضوع حيتلخبط. فإتس بيتر ثينج، حتى إتس بيتر ابروتش، العيان يتكلم اسكت، خليه يكمل كلامه وبعدين واصل، عشان بس الناس ما تخش في لخبطه.
بالضبط.
ثاني.
ف it is open يعني يا اخوانا، الفلور is open for anyone whoever would like to proceed. just proceed طوالي. اسمك محمد ولا بدون محمد؟ بروف فتح العليم كان عنده عمل في اسماء محمد، لكن ما صادفت محمد الليله. فنشوف ان شاء الله خديجه تخش، لو عندكم واحد اسمها خديجه. رايك شنو يا ابو فتح العليم؟ كويس الحمد لله، لكن بس هو عشان عيان.
خلاص we have to choose يعني somebody else from the names. إذا
Yes,
كان باقي عندها names نختار واحد.
exactly. ايوه، وزي ما قلنا يا شباب، we should never ever يعني be concerned or worried about about الاكسنت. يعني ما خلاص احنا نعتز انه لغتنا الاصليه العربيه، وبنتكلم معاهم بالانجليزي بنعرفه، وبس بعد شويه شويه تقدر الواحد انه يفهم الاكسنت حقتهم، ويقدر يقول لهم اكسنت هم يفهموها. الهدف بس انه البيشنت يفهم الاكسنت حقتنا، لكن ما لازم نلوي خشمنا ونكون زيهم يعني، بس المهم انه يفهم الاكسنت حقتنا، بيفهم البيشنت ذاته. اوكي، ف there is no problem. حتى لو انا البيشنت قالت لي حاجه وانا ما فهمتها، sorry can you say that again please، كده يعني البيشنت بتقول لك تاني. فاي واحد عايز يخش يخش او وحدي.
Come on boys, come on girls. يلا.
ايمان، تفضلي طوالي.
السلام عليكم.
وعليكم
أنا إيمان.
السلام ورحمه الله.
سلام.
عارفة. أهلا
طيب،
وسهلا.
ايمان محتاجه مثلا نمر على الاسئله تاني ولا يو وانا بروسيد طوالي؟
إن شاء الله يوفر طوال.
كويس. حاجه تانية في بدايه الكيس، انه جت تشتكيك، سواء انت الشكوى شايفها يعني هناك، يعني ليلى قالت لك انا I'm not able to move my arm مخلوعه، شويه كده الناس تتفاعل مع العيان شويه. يا اخي I'm sorry but you're يعني I'm sorry this sounds like a very
أيوة.
frightening experience.
Okay.
دي درجه جايه ببلاش في اي انترفيو، فما الناس ما تفوت الدرجات هناك اللي ببلاش زي دي. اوكي
Okay.
نبتدي.
Okay. إن شاء الله. طيب.
طيب.
Hi, thanks for seeing me. Sorry, I don't think I caught your name.
Hi, Lucy. This is Dr. Iman. I'm the psychiatrist working here today. How are you doing?
All right, Hi, Dr. Imam. Honestly, I'm a bit all over the place. I still can't move my arm, and no one seems to know why. It's just
Oh, mhm.
really worrying. I've never
Yeah.
had anything like this happen before. I just want to know
Okay.
what's going on.
Mhm. I'm so sorry to hear about that. It must be a very frightening experience. Was it?
Yeah, it's definitely frustrating. It's also a
Okay.
bit scary, if I'm honest.
Mhm.
1 minute I
Yeah.
was fine, and then suddenly my arm just stopped working. I keep thinking
Okay.
maybe it'll just go back to normal, but it hasn't. I feel like I'm in
Mhm.
limbo, waiting for someone to explain it to me.
Uh-huh. Lucy, I have to ask you some questions so that we can understand better what's going on with you, so we can help you the best way. Is that okay?
Yeah, all right. I get that you
Okay.
need to ask questions. I'll try my best
Oh,
to answer, just
mhm.
can we take it slow? I'm still a bit
Yeah,
upset about all this.
of course, we're going to do that. Lucy, can you take me back to when did this all started?
It started at my sister's house during a family get together. We were all
Okay.
just sitting around, and then, well,
Mm-hmm.
I noticed I couldn't move my right arm. It was really
Mm-hmm.
sudden. I didn't feel anything odd before, just it happened out of nowhere. There wasn't any pain or warning. One moment I
Okay.
was fine, and then my arm just wouldn't budge. I honestly can't make sense of it.
Mm-hmm. Oh, it must be a difficult experience. When did that happen? Was this today?
No, it wasn't today. It was a
Uh-huh.
couple of days ago now. I've been
A
trying to
couple of,
see if it would just sort itself out, but it hasn't. That's why I
okay.
ended up here. I just want to know what's wrong with me.
Uh-huh. And did that started with only one arm, or did that can you tell me how did this progress?
It's just been my right arm from the start. The rest of
Okay.
me feels normal. I haven't had any
Oh,
weakness or numbness anywhere else. It's
uh-huh.
really just my arm, like it's switched off or something. It hasn't
Mm-hmm.
spread or changed since it began.
Okay. Can you remember anything in specific that happened before that?
Not really, no. Nothing out of the ordinary happened. We were just
Mm-hmm.
chatting, having some food, the usual family stuff. I can't think of anything that would have caused this. It just sort of
Okay.
happened all of a sudden.
Uh-huh. I totally understand. And have you been like facing any stressors or any difficult times recently?
I mean, life's been a bit stressful, but nothing out of the ordinary, really. Just
Uh-huh.
normal work stuff and family things, you know? Everyone has ups
Mm.
and downs, but nothing that
Uh-huh.
stands out as particularly awful right before this happened. I wouldn't say anything's been especially difficult, at least not that I can pinpoint.
Okay, okay. And Lucy,
Oh,
can you tell me about do you work or are you like tell me about your working life? Was it affected by what happened?
yeah, I work. I've got an
Ah,
office job. I've managed to
okay.
keep up with things mostly, but this, my arm, has made it really hard.
Mm-hmm.
Typing, even just carrying things, it's all a struggle now. I haven't
Mm-hmm.
told many people at work what's going on, just that I'm not well. I'm worried about how
Uh-huh.
long this might last, to be honest.
Uh-huh. And how was you coping with all of this?
I don't really know. I suppose I'm just trying to get on with things as best I can. I haven't really
Mm-hmm.
talked about it with anyone, not properly. I've just kept it to myself mostly, hoping it'd go away. I guess I've been avoiding thinking about it too much, but it's hard when it's always there, you know?
Uh-huh. Uh-huh. Yeah, I totally understand. Okay, Lucy, do you have anyone around who is helping you recently?
My
Like how
sister's
you
been
feel
around
about
quite a
that?
bit, checking in on me. She's worried,
Uh-huh.
probably more than I am sometimes. Apart
Uh-huh.
from her, not really. I haven't told many people about what's going on. I just don't want to make a fuss or have people looking at me differently.
Mm-hmm. Okay. And Lucy, can you tell me about your mood, like the last 2 weeks? How was your mood?
It's been up and down, honestly. Some days I feel
Mm-hmm.
all right, just trying to get on as normal. Other days, I just feel low, frustrated, a bit hopeless, I suppose. I've been more tired than usual, too. I wouldn't say I've been happy, but I'm not completely falling apart either. Just
Uh-huh.
flat, if that makes sense.
Okay. Were you able to enjoy things that you used to enjoy in the past?
I haven't really been doing much of that lately. Things I used to enjoy, like going out with friends or even just reading, haven't felt the same. I suppose I've been
Okay.
avoiding stuff, keeping to myself more. It's hard
Mm-hmm.
to get
Okay.
motivated when I feel like this, and honestly, I just don't have the same interest right now.
Uh-huh. Yeah, and what about your sleep pattern? Any changes?
Yeah, my sleep's been all over the place. Some nights I can't fall asleep at all, just lying there thinking. Other times I wake up really early and can't get back to sleep. I feel tired most days, even if I do
Uh-huh.
get a few hours. It's definitely not been normal for me.
Uh-huh. And what about your appetite?
My appetite's not been great either. I've not really felt hungry much lately. Sometimes I just forget to eat, or I'll pick at food and not finish it. It's not like me, but
Uh-huh.
I just don't have much interest in meals these days.
Okay. And Lucy, with all of this going on, have you ever thought about ending that all, like doing something to end your life?
No, I haven't thought about ending my life. It's been
Mm-hmm.
tough, but I wouldn't do that. I just want to
Oh,
feel normal again and figure out what's wrong. I do get
okay.
overwhelmed sometimes, but I'm not thinking about hurting myself.
Okay. I'm glad to know that. That's good. And any negative ideas about life or about anyone else, like thinking about harming someone else?
No, nothing like that. I haven't
Okay.
had any thoughts about hurting anyone else. I just
Okay.
want to get better and get back to normal. That's all that's
Okay.
been on my mind, really.
Okay. Lucy, sometimes people have some strange experiences like hearing voices when no one is around or seeing things. Have this ever happened to you?
No, that's never happened to me. I haven't heard voices or seen things that aren't there. It's
Okay.
just been the thing with my arm and feeling a bit down, that's all. Nothing
Okay.
else
Okay.
unusual like that.
Okay. Lucy, have you ever been seen by a psychiatrist in the past?
No, I haven't. This is
Oh,
actually the first time I've ever spoken to a psychiatrist. I've never
uh-huh.
really needed to before. Or at least I didn't think I did. This whole thing with my arm is what brought me here.
Okay. And what about like your physical health? Do you have any difficulties? Any medical problems?
No, nothing major. I've always been
Okay.
pretty healthy. No big medical problems.
Uh-huh.
I don't take any regular medication or anything like that. Just the usual colds and things now and then, but nothing serious. This is
Uh-huh.
the first time something like this has happened to me.
Okay. Okay. Thank you for sharing that with me. Lucy, I want to ask you some questions about your life, like when you were young, like any childhood difficulties when you were growing up, walking or
Not really, no. My childhood
Mm,
was pretty normal, I think. I got on
okay.
well with my family, did all right at school, nothing out of the ordinary. I
Uh-huh.
can't think of any big issues or anything traumatic when I was younger. Just the usual ups and downs, but nothing major.
Okay. And how is
Oh,
your social life, your relationships with with your peers in school?
It was all right, I suppose. I had a small group of friends, kept to myself a bit, but never had any real trouble with anyone. I wasn't the most outgoing, but I got on with people well enough. Nothing stands out as a big problem from back then.
Uh-huh. Okay, so nothing major happened in the past. Okay.
No, nothing major. Like I
Okay.
said, things were pretty
Oh,
normal growing up. Nothing that would explain what's happening to me now, if that's what you're getting at. This
uh-huh.
whole thing with my arm is just completely out of the blue.
Mm-hmm. Mm-hmm. And Lucy, can you tell me more about who's living with you at home? Do you live alone or someone is living with you? Are you in a relationship currently?
I live on my own, actually. My
Uh-huh.
sister pops by quite a bit, especially since all this started, but I don't live with anyone else. I'm not in a
Uh-huh.
relationship at the moment either. It's just me at
Uh-huh.
home most of the time.
Okay. And Lucy, with these difficulties, have you ever tried to cope with that by using like drinking more than usual amount of alcohol or using any other medications or any drugs?
No, I haven't. I don't really drink much, and I don't use any drugs or anything like that. I haven't started
Okay.
taking anything new since this happened either. I've just been trying to cope on my own, really.
Uh-huh. Uh-huh. Okay. And any troubles with the police or uh, any legal issues
Sorry, I'm
happening?
not sure. No, nothing like that. I've never had any trouble with the police or any legal issues.
Uh-huh. Yeah. These are routine
Right.
questions.
If there's
Nothing.
anything else you...
Yeah.
It's okay. I get that you have to ask them. It's just a lot to take in right now, but I'll try to answer whatever you need.
Thank you. I appreciate that. Lucy, if I ask you to like to describe yourself, if I ask you what do you think other people will say about you in the past, like how do they describe
I
you
suppose...
as a person?
Sorry, could you repeat that? I'm not sure I caught what you were saying.
If I ask you what other people around you would say about you, how they describe you as a person, what would you say?
I think most people would probably say I'm quiet, maybe
Uh-huh.
a bit reserved. I try to be reliable and supportive, especially with family and close friends. I'm not really
Mm-hmm.
the loud, outgoing type. I tend to keep things to myself. But I think
Uh-huh.
those who know me well would say I'm caring and thoughtful, even if I don't always show it openly.
Uh-huh. And are you like flexible with problems and you know how to cope with difficult times or you face difficulties in managing that?
I try to be flexible, I suppose. I usually just keep my head down and get on with things when life gets tough. I don't really talk much about my problems, though. Just deal with them quietly. Sometimes that works, sometimes it doesn't. Lately, it's felt a bit harder to cope than usual, if I'm honest.
Uh-huh. Uh-huh. Lucy, about your family, do you have anyone in the family with any mental health problems or similar to what's happening with you?
No, not that I know of. My family's
Mm-hmm.
generally been pretty healthy, both physically and mentally. No one's ever had anything like what's happening to me now at the blue for us.
Uh-huh. Okay.
Are you still there?
Yeah. Just a moment, Lucy.
All right. Just let me know if you... All right, Dr. Imam, thank you.
Lucy, sorry, I'm facing some network issues. Can you hear me clearly? Lucy?
No worries. I understand. Let me know if you need me to repeat anything or if there's something you want to ask again. I'm here.
Okay, from what you told me, Lucy, you told me that what are you experiencing has happened out of sudden, and you face
Yes,
difficulty
that's
or
right.
okay, yeah, you're unable to move your right arm. Uh-huh. Am I right?
Yeah, exactly. My right
And
arm
there,
just stopped working. I can't move it at all, and it's been like that since it started.
okay, and this have been happening since of couple of days ago, right?
It's been a couple of days now.
Yeah, and
Yes, that's
Lucy,
right. It started a
yeah,
couple of days ago and hasn't changed since. Still can't move it.
how do you feel about that? Like being unable to move your right arm?
Honestly, it's frightening. I keep
Lucy, I think I've lost you again. Hello?
thinking.
في مشكلة في الفيديو يا ياسر، ولا أظنها
في
خلصت مش كده؟
ما عندي فكرة.
خلصت؟
انا افتكر I'll wait again on her.
لا
Huh?
خلاص
And
خلصت. أفتكر this
okay,
is
Sorry.
enough مش كده؟
لا she's
I'm not sure I under.
أوكي.
Sorry. I'm not sure I
okay.
understand what you mean. Could you say that again, please?
I'm so sorry. Like I was facing some difficulties, like hearing your voice. Can you hear me well?
Yes, I can hear you fine now. No worries.
Okay.
Let me know if you
Okay.
want me to repeat anything or if you need to go over something again.
Okay. Thank you so much. I think you've shared a lot with me, and I do appreciate that.
All right.
Uh,
Thank you.
do you have any questions, or you think
Thank you
that
for saying that.
you can share with me?
I just want to know if this is something that's going to get better or if there's anything I can do to make my arm work again. It's been really
Mhm.
stressful not having answers. If there's anything else you need from me, just let me know.
I totally understand your concern, and it must be very stressful for you experiencing that. I believe that you've been seen by the medical doctor, the neurologist, and he did he did an evaluation for you, and he thinks that this is not
Yeah.
something physical. I mean, related to your medical condition, a medical condition. So sometimes something like this can happen, actually, um, when people go through stressful times, like our mind and body are connected to each other. So sometimes our body, yeah, are you following me?
Yes, I'm following you. You're saying that sometimes stress can affect the body, even if
Yeah,
there's nothing physically wrong. I just
exactly,
find it hard to
exactly.
believe that stress alone could do something like this to my arm. It doesn't feel
Yeah,
like that could be the reason, but I hear what you're saying.
yeah. Actually, Lucy, this is something common to happen to many people. And don't worry, because this is manageable. There is management for that. And like we can work together on that to help you the best way.
All right.
How do you think about that?
All right, if you say so. It's just a lot to take in. I never thought something like this could happen to me, especially out of nowhere. I just want to get back to normal, really. If there's something that
Mhm.
can help, then I'm willing to try.
Uh-huh. Okay. So, you want me to walk you through
Okay?
what do we have?
Yeah.
Okay. Have you ever heard about talking therapy called CBT, cognitive
Sorry,
behavioral
I'm not sure what you mean. Do you mean
Mm-hmm.
what options there are for treatment or something
Uh,
else?
yes, yes.
I've heard of it. Yeah. Cognitive behavioral therapy, right? I don't know
Yeah.
much about it though. I know it's meant to help people deal with stress or anxiety,
Yes.
but I've never tried it myself. Do you think that would
Uh,
actually help with something like this?
yeah, actually, we will find this very helpful in situations similar to the one you're having now. It's a kind of talking therapy where the therapist will help you to,
All right.
the therapist will help you to
Okay.
change negative thoughts that we sometimes people having and how to manage them. Because as I told you that mind and body are connected, so sometimes the thought that we
I
have
see.
affect our feeling and this will affect our behavior. So this is the area where cognitive behavioral therapy will work. Are you willing to start it? Oh, thank you. الو
ايوه خلص مش كده؟ خلص
حلو
افتكر.
صحيح.
اي
اوكي. اوكي. انا I can only say it is excellent, more than excellent والله يا ايمان ومرة الطيب. It was very very good, very straightforward, very clear questions, very good communication skills. باختصار لو دي كانت اوسكي ستيشن وانا كنت الاكزامينر I will give you a score of 10 out of 10 والله. نسمع رأي بروفيسور فتح العليم ورأي دكتور ياسر ومهجة والجميع حقيقة، لكن excellent. thank you.
شكرا يا الله. شكرا.
Yeah, I'm impressed really by your courage انك انت to come forward عشان to take over. طلعتينا من المأزق ده. And I'm impressed زي ما واجري with عبد الغني. والشيء الوحيد اللي احب انبه له are you listening to me ولا انتوا معاي؟
ايوه
أيوة يا
معاك يا
بروف،
بابا.
واصل، كلهم
You
سامعين لك.
are, you are,
واصل يا بروف،
you are.
يديك العافية.
كثير يعني so many patients بيدينا مرات بيكونوا بدونا كوز or leading probes كده في حالتهم أكثر. I wish انه كان الدكتوره لو كان she just took over الحاجات اللي هي قال بدات تديها ليها. مثلا هي دكتوره كانت very good in probing into what looks to me like depression. ومشت فعلا سالت كان first important question اللي هي المود. كان يا حبذا لأنها شايفها كانت بتتوقف، يا حبذا لو استمرت تسكرينها for symptoms of depression أكثر، لأنه كان حيسهل لك الموضوع أكثر يبدو لي كده يعني، ولا حتى symptoms of anxiety and so on، لأن هي بدأت توصف شخصيتها وبدأت توصف what looks to me like some form of depression, mild or moderate depression going on for some time. This is my only point. كان بيسهل لنا الحكاية أكثر على الإيتيولوجي. ده رأيي غاية ما أعرف الرأي الباقيين شنو. ياسر.
thank you بروف. yes you are absolutely right. بس لو لاحظت يا بروف فتح العليم، هي عندها very high level of denial. البنت دي لوسي دي عندها denial شديد، لكن بالرغم من كده لما إيمان سألتها عن المود قالت لها yeah it's ups and downs for the last 2 weeks, sometimes my mood is low. يعني أكدت الحكاية دي، وسألتها عن السليب والابيتايت، وزي ما قلت كان more questions about energy. سألتها عن الديث ويشز والسوسايدال اتمتس يس، وحتى سألتها عن سايكوتيك سيمبتومز. فيري جود والله جدا. رأيك ممتاز يا بروف. تفضل ياسر ومهجة وبعدين الترينيز.
مهجة تفضل، أنا بعد مهجة.
والله أنا I think إنه excellent. إيمان ما شاء الله عليكي. ما عندي كومنت تاني.
طيب انا غاية كومنتاتي بسيطه في الاخر. ايمان والله was excellent. لو الشبكه دي كانت ساعدتك شويه افتكر it would have been really excellent، لكن في مشكله افتكر هي قطعت في ديسكونكت حاصل. it's not optimum لكن it's excellent. في حاجه بس انا داير انبه عليها في الانترفيو، اللي هي ساعات الواحد بيعملها ما بيكون منتبه. الفاسيليتيشن اللي هي انت مثلا مثلا دي بتعملها، لما تعملها كتير كانك بتديك امبريشن انت قاعد تختصر العيان، يعني تقول وخلص. فشويه يعني if you try، انا ما بقول لك وقفيها، لكن make it اقل شويه، لانه ساعات بتكون يعني كانك انت بتقاطع العيان، وانه كان بيقول له اختصر وقوم من الاخر. فجست يعني دي حاجه بس to pay attention to. فدي بس otherwise you've done an excellent job.
فيري جود. طيب مهم جدا النقطه اللي قالها دكتور ياسر، وحقيقه ندي في الكالتشر بتاعت الخواجات. يعني احنا يمكن في الكالتشر بتاعتنا بيقول بيعتبرك انت مركز معاه اكتر، لكن هم بيعتبر الخواجات بيعتبروا انك انت بس عايز تخلص. ايوه. لكن اكسلنت، شو اكسلنت الحقيقه. وزي ما قلنا البيشنت برضه شو كوبرتيف، لكن ات ذا سيم تايم يعني كانت سالت عن الريليشن شيبس، لو عندك ريليشن شيب، سالت عن ساكنه مع منو، شغلك كيف. فيري جود والله. وبعد ذاك ايمان explain to her that we can help her. Very important برضو انه برضو قالت لها ايمان انه yes I understand that you have been seen by a neurologist and he could not find anything. ما نقول لها ما لقى حاجه، he could not ما عندك حاجه، لا he could not find anything and we'll try to help you. ده اللي قالته ايمان. I think was excellent. ولو في اي واحد من الترينيز عنده كومنت برضو قبل ما نمشي للحاله الثانيه اتفضل.
يا
السلام
جماعه
عليكم.
الكحه سمة الخشب. طارق.
اكسلنت اسسمنت باي دكتور ايمان. بس انا اعتقد كان في سيستم المفروض كان كبير يسوي بكويستشن بيت، ولا انا غلطان في الحاجه دي؟ سامعني؟
السؤال ما سمعناه، والسؤال شنو؟
كان في سيستر supposed to be reassured and questioned.
كان معاه سيستر
مسموع
يا
الصوت؟
ياسر؟ I don't know. كان معاه سيستر؟
السيناريو بيقول انه في سيستر، لكن ما لقانا سيستر.
ما كان
اوكي.
معاه. لو معاه كان بتقول ايوه، كان بتقول this is my sister with me. ايوه ما اظن.
بس السيناريو كان مكتوب عشان كده.
all right okay thank you.
السلام عليكم. لينا بابكر. I think it was an excellent case presentation. بس أنا عندي it's more of a question rather than comments on Iman's performance. In such a interview لما البيشنت يقول لي إن هو tired أو exhausted أو overwhelmed, would it be advisable إن to go over the full interview, ولا أخليها more focus وممكن إن follow up ناخد الحاجات الثانية اللي ممكن تكون more of a general than إنه هي متعلقة بالسيناريو. Thank you.
انا ممكن اديك اجابه مختصره: validate and move on. يعني validate معلش يا اخي it sounds like this is a very difficult time for you، وبعدين واصل question. ما هي في الاخر ما حقيقيه. بس validate اهم شيء. نقول لك كلام زي ده ما بقول لك عشوائيا. validate.
لا أنا ممكن ما شرحت السؤال كويس. أنا قصدي إنه would it be advisable to go over the full questions of the psychiatry interview لما البيشنت يقول إنه هو يعني ما قادر ياخذ الأشياء كلها مع بعض، أو يعني كده عاوز حبة حبة زي ما بقولوا، ولا أركز بس أسأل أسئلة معينة focused on the situation نفسها، وممكن الأسئلة زي ال childhood
لا
ما
ايوه
أعرف شو الحاجات
انا
دي
فهمت
later.
السؤال يا لينا. لا انا فهمت السؤال. no you always go systematically، ولكن at the same time تقولي at any time، تقولي البيشنت any time you feel that you are exhausted you want to have some rest you just tell me. لكن انت تمشي systematically. يعني معروف التايم مثلا في الاوسكي ستيشن 10 minutes في الاوسكي ستيشن، فانت في الاوسكي ستيشن بتنظم ال 10 minutes للحاجات الاساسيه زي ما قلتي. لكن في الريال لايف انترفيو مع نيو بيشنت، انا ما اعرف ناس ياسر بيخصصوا كم، لكن احنا في السودان بنخصص 45 minutes to 1 hour for the new patient. يعني لازم نقعد معاه 45 دقيقه الى ساعه. ففي الحاله زي دي you have to go systematically. الا لو بيجي قال خلاص I don't want anymore، دي حاجه ثانيه طبعا. ما بنعمل حاجه against the will of the patient. لكن لو قال لك والله انا تعبان ولا، لكن okay can you continue؟ لو قال لي yes I can continue، تمشي سيستماتيكالي. ما تلغي حاجات عشان البيشنت مستعجل ولا متضايق. اوكي.
Okay, thank you so
لكن
much.
دائما في الاوسكي ستيشن make use of the time. عارفه انه الاوسكيتيشن هيقول لك you have 10 minutes. في 10 minutes
Yeah.
I would like you to take a full psychiatric history from Lucy. فطوالي بتاخد البيرسونال داتا طوالي بسرعه البيرسونال داتا. لوسي عمرك كم؟ متزوجه ما متزوجه؟ شغاله شنو؟ شغاله ولا ما شغاله؟ شغاله شنو؟ يمكن شغاله في مصنع بتستعمل يدها. Does your work involve your right arm, physical strength to your right arm or not كده. بعدك ترسليها الاسئله.
Yeah.
ففي 10 minutes تختلف عن الريال لايف انترفيو 45 minutes. اوكي؟
Yeah. Good. Thank you so much.
السلام عليكم.
عليكم السلام.
مساء الخير. شكرا يا دكتور امان على الانترفيو الرائع. بس انا كان ما اعرف ما تابعته. سالت عن الفانكشنال امبيرمنت يعني في الديلي اكتيفيتيز والورك والريليشن شيب. كانت خططها وانا ما لاحظت لها
مش
الفانكشناليتي
سألتي
يعني.
ايمان؟ قالت لي انا I am not in a relationship. بفتكر سألتها مش كده يا ايمان ولا شو؟ ردي يا ايمان.
سألتها عن الشغل وقالت إنها حتى لو في تايبينج، حتى التايبينج دي عندها في المشكلة. وفي الهوم قالت عندها her sister is helping her وكده. وشي's not
ايوه.
currently in a relationship. أيوه.
وبعدين الموضوع كله له يومين بس يعني. just 2 days الموضوع. ايوه.
اوكي شكرا.
couple of days. ايوه. thank you. طيب نمشي للسكند كيس يا ياسر.
طيب تمام.
انا افتكر معلش لو سمحتوا لي دكتوره دانا موجوده؟ دانا مدثر. ايوه دانا. دانا مدثر هي بتحضر معانا طوالي. هي تريني في البورد العربي. ولكن دائما بتحضر معانا والله. ف if you like to participate يا دكتورة دانا you are more than welcome with the next case. ما عارف دانا معانا، شايف في سيما معانا غايته لكن الميكروفون ميوت. دانا بنت بروفيسور مدثر علام اناتومي.
طيب دقيقة هنا. ده أنا معانا ولا معانا؟
ما غايته هي معانا اونلاين لكن ما عارف الشبكة بتاعتها ولا لا. anyway anyone else مدام دكتورة دانا you did not respond. anyone else؟
في زول فتح الميكروفون وفي باك جراوند نويز فما عندي فكرة.
تلفزيون ولا؟ طيب
أنا هعمل ميوت للجماعة دي الناس دي كلها. أوكي يا الصوت راح.
alright. طيب ونروح هيشوف الكاس الثانية يا شباب.
أنجلي شارما.
السلام عليكم ورحمة الله وبركاته.
عليكم السلام ورحمة الله. خلف الله.
الله يبارك فيك. كيف يا بس؟ الله بخير. كيف يا
تمام.
بروفيسور؟ بخير. ربنا يعافيك.
مرحبا بك يا خلف الله. الله يسلمك.
الله يبارك فيكم انتم. Can I take this case?
طوالي.
Yes you can of course. Thank you.
Okay. Thank you.
طيب.
Thank you so much.
تمام خلف الله. البيشنت نيم أنجلي لكن ما تاخذ الكلام مني لحد ما اسمع اسمها أصلا. Anjali Sharma. You are about to meet Anjali Sharma, a 37-year-old lady who has been directed to you by a cardiologist. Over the past year, Anjali has consulted various cardiologists. Due to persistent chest pains, she has undergone numerous tests, including ECG, echocardiograms, stress tests, all of which have returned normal. It's a similar case زي اللي قبلها plus or minus with a different focus. Please engage with her to gather a comprehensive psychiatric history concerning her symptoms.
Okay.
البري reading احنا بنتكلم هنا عن illness and anxiety disorder، لكن في الآخر it's a form. Illness and anxiety disorder, previously known as hypochondriasis, is characterized by an excessive worry about having a serious, undiagnosed medical illness. These individuals often interpret normal bodily sensation or minor symptoms as severe illness signs despite medical evidence to the contrary. According to the ICD-11, IAD falls under category of somatic symptoms and related disorders. Understanding the diagnostic criteria in ICD-11 and the management recommendation by NICE guidelines crucial for effective treatment. NICE guidelines overview. While specific NICE guidelines for IAD are not detailed, recommendation for related conditions such as somatic symptom disorder emphasizes the importance of positive doctor-patient relationship, psychological therapies, especially cognitive behavioral therapy, and careful monitoring rather than excessive medical testing. Communication skills, engaging with patient with IAD, empathy and patience, recognize the genuine distress your patient is experiencing. Statements of validation and understanding can help build rapport. Active listening. Pay close attention to the patient description of symptoms, fears, and impact of these in their lives. This helps in understanding the depth and anxiety distress. Open-ended questions encourage a narrative that follows, allows the patient to express concerns, feelings, and any specific incidents that may have heightened their anxiety. Avoid medical jargon. Use simple, clear language to explain findings, reassurance, and plans. Complex medical terms may increase confusion and anxiety. Nonverbal communication, maintain eye-to-eye contact اللي هو كلام سمح. Not understanding ده كلام كله ما هيحصل. طيب
طيب
and open postures to convey your engagement and empathy. Key questions to ask Angel Sharma. Can you tell me more about your chest pain and when you first noticed them? How have these concerns about your health affected your daily activities or your mood? Have there been any changes in your life or stressors that coincided with the start of your symptoms? How do you feel after visiting a doctor or receiving test results? Have you found any strategies or support helpful in managing your worries about health? Can you share how your family and friends respond to your health concerns? Have you ever sought counseling or therapy for anxiety or stress? If not, would you consider it? Engaging a patient like Angel Sharma requires delicate balance of medical knowledge, empathy, and communication skills. By focusing on a patient experience, validating their concerns, and guiding them toward appropriate psychological support, you can help elevate the distress associated with illness and anxiety disorder. Remember, the goal is not only to address the lack of physical illness, but recognize and treat the underlying anxiety contributing to the patient's suffering. تمام يا خلف الله؟
اوكي تمام.
اوكي اتوقع دي is gonna be a 20 minutes ولا حاجه زي كده انترفيو. انا هسلمك الكيس والميكروفون وهنقعد في الباك جراوند ساكتين.
تمام.
انتوا عندي في باك جراوند جاي من عندي انا، في باك جراوند نويز من عندي ولا لا؟ قبل ما نبتدي.
طيب هنا هسه جنبي
لا ما في.
مكيف
تمام
مسمين صوته ولا حاجه؟
تمام غايته هنبتدي.
Hi. Look, I appreciate you seeing me and all, but I want to jump straight into it, okay? No one can tell me what's wrong. I've had all these tests and they're normal, but the pain is still there. It has to be something serious. What if they've missed something?
Okay, first, Angela, I'd like to introduce myself to you. I'm Dr. Falafallah, the psychiatrist in the service today. I'm happy to hear you and help you going through your issue.
All right, that's fine. But honestly, what I need is for someone to take my chest pain seriously. I've been to so many doctors, and every time the tests come back normal, but the pain doesn't stop. I'm really struggling to believe this is just stress or anxiety. I just want someone to help me figure out what's actually wrong with me.
Okay, I understand that this might be distressing for you.
Of course, it's stressful. I've been living with this pain for a year and no one can give me answers. It's not just in my head.
Yeah.
This is real and it affects everything I do. I just want someone to actually listen and not brush it off as just stress.
Yeah, I understand your concern. I understand what you are going. This must be very stressful and hard experience.
Yes, it is stressful. It's exhausting. Actually, I feel like I'm constantly on edge, worrying if something serious is being missed. I just can't accept that
Okay.
it's only stress causing all of this pain. It's not like I'm imagining it. The pain is real and it's there every single day.
Yes, I understand. Okay, in order to help you, Ms. Angela, I would like to talk about some issues about your symptoms and your experience in general. Can I proceed with that?
All right, that's fine. But please, can we actually focus on my chest pains? That's what I'm really worried about. I just want to understand why this is happening and make sure nothing has been overlooked.
Okay, Ms. Angela. This chest pain, please describe it for me. Is it like a pressure light? It's like a stabbing? It's like moving, something like moving anywhere in your body?
Sometimes it feels like a dull ache, but other times it's sharper, almost like a tightness in my chest. It's not constant, but it never really goes away either.
Yeah.
It can get quite intense, especially when I'm stressed or thinking about it. But even when I try to distract myself, it's still there. I just can't ignore it.
Yeah, I understand. And Angela, for this chest pain, I think that you have been seen by a doctor, a GB doctor. Is that correct?
Yes, that's right. I've seen several doctors. My GP, a couple of cardiologists, even went to the hospital once because the pain got really bad. They did ECGs, blood test, an echocardiogram, and all sorts of things. Every time they say the results are normal, but the pain is still there. So, how can that be? It just doesn't make sense to me.
Yes, I think I understand that this might be very, very hard to not to be sure about what your problem is. But let me explain more for you. Such pain
All right.
could be a real pain because of some problem with your body, like your heart, maybe your lungs, maybe. But also it might be something not physically present. Understand me?
How can pain like this not be physical? I mean, I know my body, and this doesn't feel like something that's just in my mind. I get that stress can do things, but this is real pain. It wakes me up at night sometimes. I just can't accept that anxiety or stress could cause something like this. What if they're missing something serious?
Yes. I understand you. That must be very important to try
Exactly.
to
It is important.
to investigate it. Yeah.
Sorry, I'm not sure
Yes.
who that is. Can we please stay focused on my chest pains? That's what's really worrying me right now.
Okay. So you say that your chest pain is like a pressure light, it's like chest tightness and like heaviness. So do you feel sweaty or shaky or something that the pain moving up to your neck and jaw or like that?
Sometimes I do feel a bit shaky, especially when the pain gets worse or when I get really anxious about it. I wouldn't say I feel sleepy though. The pain sometimes
Yes,
feels like a tight band across my chest, and occasionally it can feel
yes.
like spreading a little towards my neck or left arm, but not always. That's part of why I worry it's something serious.
Mm. Okay, I understand. I completely understand your concern. But
Thank you.
Angela,
I
listen to
just
me.
want someone to actually listen, you know? It's really scary living with this pain and not knowing what's causing it. I just want to feel normal again and not worry every single day.
Yes, yes. Please be reassured.
All right, I just
I
hope we
can
can
assure
find
you
some
that.
answers. I really need some peace of mind about all this.
Yes, yes. No problem. If you have any findings of past investigation results, we can go through it.
Sorry, I'm not sure what. Honestly, it feels like nothing has really been resolved. Every time I go to a doctor, they say the tests are fine and send me home, but the pain just keeps coming back. It's frustrating, and honestly, it makes me feel like no one believes me. I just want to know what's actually wrong so I can finally move on.
Yes, yes. I think that is very distressing for you. But Angela, yeah, after I can judge about your symptom,
Yes,
it might be something linked to your mind more than linked to your body.
but how
You
can you be
you
sure?
know.
I mean, everyone keeps saying it's in my mind or it's anxiety, but the pain is real. It doesn't just disappear because someone tells me it's stress. What if you're wrong and it's something serious that everyone has missed? I just don't want to take any risks with my health.
Yes, yes, you are correct. We must be sure about nothing
I just want to be.
serious is happening.
Well,
Nothing
I
serious is
just want to
happening.
be. Exactly. That's what I'm saying. It's happening to me every single day. I know what I'm feeling, and it's not something I can just ignore or wish away. I just want someone to really take it seriously and not just tell me it's all in my head.
Yes, it's understand that, Miss Angela. Okay. So,
Yes, it's happening,
let's
and it's very real for me. I just want to get to the
okay,
bottom
okay.
of it and finally feel like someone understands what I'm going through.
I understand your concern very, yeah, yes, for very amount of knowledge and acknowledging what's your situation. So I'd like to
Thank you.
run you some tests and investigations to make sure about your fact of your symptom is
I just want to make.
something physical,
Exactly.
something
I
physical
want to be
or something
absolutely sure
serious.
that nothing physical is being missed. I need that reassurance
Okay,
before I can even think about anything else. How can I focus on coping or dealing with anxiety if I'm still worried there's something wrong with my heart or something else serious?
okay, no problem. But from the background that you have done many tests for your test plan, like ECG, maybe you did echocardiography, maybe you did serum troponins,
Yes.
and other and that stuff, and all of that come back normal.
Yes.
That can make something special for us here, and that is
But what
this
if the tests
test
miss
plan
some?
is not serious. It's not serious at
That is
all.
exactly why of course I'm Of course, I'm serious. This pain has completely taken over my life. It's not something I can just ignore or pretend isn't there. I wouldn't be here if it wasn't real or if I didn't honestly believe something is wrong. I just want someone to finally help me understand what's happening to me.
Okay, understand what's happening to you. Please give me my give me time
It's this constant
and
pain and
trust.
tight.
Okay, I
Exactly.
understand
Even when
that
I'm
you have.
trying to relax or distract myself, it's still there in the background. It just never really goes away. That's why it's so hard for me to believe it's just stress or anxiety.
Okay, okay. Okay, Ms. Angela. What I'd like to make it clear is that you are now fine, and nothing serious with you. Nothing serious with your heart. This must be not something that
Wait,
breaks for
what do you mean you're not
anxiety.
interested? What is it? If you know something about what's causing this pain, please just tell me. I'm desperate for answers.
Okay, okay, Ms. Angela. I can explain to you that this
All
pain
right?
is something.
If you have
It's something
something to
like
say,
coming out of
or
your
if
mind, coming out from your
sorry,
anxious
I'm
mind,
not.
and not.
See, I'm not sure I follow what you mean. Are you saying you think this pain is just in my mind? Because it doesn't feel that way to me at all. This is real and it affects me every single day. I just want someone to actually understand that. Are you still there? Are you still there? Are you still there?
خلف الله معانا. خلف الله.
Sorry, I don't really understand what you mean by California. Can we please stay focused on my chest pains? That's what I'm really worried about right now.
ما خلف الله في السودان احتمال النت قطعت منه يا ياسر.
انا حنهي الكيس وبعدين نرجع لخلف الله.
اوكي.
افتكر he went through in a very good way بعدين ممكن اديه الفيدباك هسه بس انا حنهي الكيس.
يس يس افتكر خلاص لانه هو في السودان و most
I'm not
probably
sure I understand what you mean. Can we please talk about my chest pain and why it's happening? That's what matters most to me right now.
كده انت خليكي بالجنبه.
قول لها كده اسكت شويه كفاك الليله.
خلف الله رجع ولا ما رجع؟
بتكون النت ضاعت يعني he did very well والله
he
برضه
did very
يعني.
well.
ايوه. لو في كومنتس من الاذر ترينيز بروفيسور فتح العليم برضه يعني بيكون كويس.
والله طبعا يا agree انه he really did his best عشان to very difficult situation وده واحدة من الديسوردرز الواحد اصلا ما يتمنى يشوفها.
صح والله فعلا.
لكن I think he did his best بس اللانجوج طبعا هي كان عائق واضح في الانتراكشن معاها وهي she is a very difficult patient لانها she يعني الدرايه زي ما قلت يا عبد الغني بتاع انه nothing wrong with her. الواحد زي الحالات زي دي احتمال لو سأل عن what do you think is the cause يعني هي مع
نعم.
انها نوع الحكايه دي
ايوه.
ممكن
يس.
تكون opening كده يعني to explore her worries اكثر لكن otherwise it's okay.
يا he did well فعلا وفعلا I agree with بروفيسور فتح العليم very difficult cases الكيس زي دي لانه بيكون في denial. كيف هي قال البين ده فيزيكال معناها فيزيكال خلاص وما مبسوطه من اراء الدكتور الشافت الجنرال براكتيشنر ولا الفيزيشن الشافت قال لها ما عندك حاجه ما عندك حاجة في الهارت، فهي عايزة يقولوا لها إنه عندك حاجة. ف عايزة صبر الكيسز زي دي فعلا. ويوجوالي one interview is not enough. ف لازم she needs time to trust you، وبعد ذاك to accept what you say to her. أيوة. لكن did well. شايف دكتورة
يعني هي
دانا راجعت.
النقطة اللي أنت نوهت عليها، حكاية إنه المريض يمشي لكمية من الدكاترة وانفستيجيت and so on، بعدين يقول له ما عندك حاجة.
بالضبط.
فدي في حد ذاتها is very off-putting يعني.
بتزعلهم،
وإذا
أيوة فعلا.
يعني المرضى ديل الدكاترة اللي شافوهم طبعا ما بكون هيئوهم إنه ممكن another problem can be يعني sorted out by another profession. بس
absolutely.
هم ما عندكم حاجة وخلاص. ما عندكم حاجة كيف؟ دي بضحتي أنا ببيح فيها.
exactly. أيوة، وده الكلام اللي قالته لي خلف الله. كيف يقولوا لي ما في حاجة، ما عندي، وكيف إنه البين ده ما يكون فيه حاجة، معناها هي أخذت في حاجة بالضبط. فدي مشكلة كبيرة
very
حقيقة.
difficult, very difficult situation.
نعم، نعم، نعم. مم.
خلف الله
أوكي.
رجع. خلف الله معانا.
ايوه السلام عليكم.
ما
ايوه
رجع.
الله يبارك فيك.
أيوة. ما
يا
خلاص، ما
رسول.
أنا
ايوه
أفتكر
بس قطع
you did very
الانترنت
well.
طبعا. بس
أيوة،
الله
الناس
يكرمك
كل
الله.
الفيدباك من البروف ومن دكتور ياسر إنه you did very well مع الكيس.
الحمد
لكن
لله.
الظاهر الشبكة قطعت عندك، لكن you did well.
صح.
yeah
ثانك يو.
very
اوكي
well.
جزاكم الله.
excellent.
تمام.
الله يسلمك. فافتكر الوقت الباقي يا دكتور ياسر. شايف دكتورة دانا رجعت، ولو عايزة تواصل مع نفس البيشنت من الأول برضو كويس. لو دانا، لو you are interested يعني.
السلام عليكم. معلش أنا آسفة جدا، أنا كنت برا البيت والشبكة كانت حتى ما دخلت الميتنج من أول، سمعت بس آخر حتة بتاعت الدكتور اللي كان عيان وقطعت وحسي رجعت، فافتكر الميتنج على نهايته. I'm willing to do anything، ما مشكلة، ما عندي مشكلة.
والله بس أنا
أشوف.
قلت إنه يعني أنت بتشاركي معانا طوالي
يا
حقيقة لأنه
سلام
نحضرك.
يا سلام.
و...
يا
وإن
ثانك
شاء الله
يو.
أموركم تسهل في البورد العربي برضو.
يا رب
ونحن
يا
بالنسبة
رب.
لنا الترينيز كلهم، سواء كانوا البورد العربي والمجلس، الترينيز كلهم تبعنا وسودانيين. ف
يا سلام.
في البيشنت دي ممكن يعني دكتور ياسر يقراها ليكي من الأول، وبرضه تقعدي معاها تاخدي هيستوري.
سمعتيها؟
ما لا
سمعتي
ما سمعت،
الهيستوري؟
أنا يا دوب
لا
دخلتها لما
خلاص،
كتبت
يقولوا لك
المسج
تاني.
تمام.
دخلتها.
أنا
يقولوا لك تاني.
in summary. طيب هي Angel Sharma. She's a
تمام.
37-year-old lady who has been directed to you by a cardiologist. Over the past year, Angel has consulted various cardiologists due to persistent chest pain. She has undergone numerous tests, including ECGs, echocardiograms, and stress tests, all of which have returned normal results. Please engage with her to gather a comprehensive psychiatric history concerning her symptoms. في زي reading material صغيرة بتتكلم على ال illness and anxiety disorder is previously known as hypochondriasis. It is characterized by an excessive worry about having a serious undiagnosed medical illness. These individuals often interpret normal body sensation or minor symptoms as severe illness signs despite medical evidence to the contrary. According to the ICD-11, IAD falls under category of somatic symptoms and related disorders. Understanding the diagnostic criteria in the ICD-11 and the management recommendation by NICE guideline is crucial for effective treatment. And NICE guideline قال لك that there is no specific treatment, making emphasis on cognitive behavioral therapy and doctor-patient relationship psychological therapies. And careful monitoring rather than excessive medical testing. Communication skills for engaging with patient with IAD اللي هي very common لأي عيان ما عنده علاقة مثلا بالعيان دي. Empathy and patience. Recognize the genuine distress your patient is experiencing. Statements of validation and understanding can help build rapport. Active listening. Pay close attention to the patient description of symptoms, fear, and impact of these in their lives. This helps in understanding the depth of the anxiety and the stress. Open-ended questions encourage the narrative that allows the patient to express concerns, feelings, and any specific incidents that may have heightened their anxiety. Avoid medical jargon. Use simple, clear language to explain findings, reassurance, or plans. Complex medical terms may increase confusion and anxiety. Non-verbal communication اللي هي ما في الكيس دي ولا أي case. Maintain eye-to-eye contact, nod in understanding, adopt an open posture to convey your engagement and empathy. Key questions to ask in jail Sharm. Can you tell me more about your chest pains and when you first noticed them? How have these concerns about your health and affected your daily activities or your mood? Have there been any changes in your life or stressors that coincided with the start of your symptoms? How do you feel after visiting a doctor or receiving test results? Have you found any strategies or support helpful in managing your worries about health? Can you share how your family and friends respond to your health concerns? Have you ever sought counseling or therapy for an anxiety or stress? If not, would you consider it? Engaging the patient like Angel Sharma requires delicate balance of medical knowledge, empathy, and communication skills. By focusing on patient experience, validating their concerns, and guiding them toward appropriate psychological support, you can help alleviate the distress associated with illness and anxiety disorder. Remember, the goal is not only to address the lack of physical illness, but to recognize and treat underlying anxiety contributing to the patient's suffering. جاهزة؟
أيوة.
تمام. I'll proceed.
أنا بس ما شايفة حاجة في السكرين، هل في شيء؟
أحتاج أسف.
أوكي.
Oh.
Hi. Look, I appreciate you seeing me, but I want to jump straight into it. Okay? No one can tell me what's wrong. I've had all these tests and they're normal, but the pain is still there. It has to be something serious. What if they've missed something?
Hello, I am Dr. Dana. I'm the psychiatrist who will see you today. Can you tell me more about yourself, please?
Well, I'm Anjali. I'm 37. I live in Solihull. I work in finance, so I'm used to being organized. And on top of things, I try to look after myself. I eat well. I exercise. I don't smoke. But for the last year, I've had these chest pains that just won't go away. I've seen so many doctors, done every test they can think of, and no one has found anything. It's honestly exhausting and scary. I just want to know what's wrong with me.
I can understand this. Did you go to any psychiatrist before, or this was your first time?
No, this is my first time seeing a psychiatrist. Honestly, I never thought I'd end up here. I've always gone to doctors who deal with physical problems, not mental ones. My cardiologist said maybe it's stress or anxiety, but I'm not convinced. I just want to rule out everything else first.
I can understand that you went through a lot of lab investigations and also like CT and ultrasound and like that. Am I right?
Yes, exactly. I've had blood tests, ECGs, echocardiograms, stress test, even a CT scan of my heart. Everything comes back normal, but the pain is still there. I just don't understand how that's possible if nothing is wrong. It makes me feel like no one is taking me seriously.
Sure, we take care of you. And please, can you tell me more about the pain and how has it started?
It started about a year ago, out of nowhere. At first, I thought maybe I'd pulled a muscle or something, but it never went away. The pain can be quite intense. Sometimes it's a tightness, other times it's more of a sharp ache. It's mostly in the center of my chest, but sometimes it feels like it spreads a bit. There's no specific trigger I can think of. It just comes and goes as it pleases. It's honestly frightening, and I just want to know what's causing it.
I understand. And did you feel that it's mostly because of stress? My question is, are you having any recent stressors going on?
I mean, life is always stressful, right? Work can be demanding, and I do worry about my family back in India sometimes. But nothing out of the ordinary happened when this started. I can handle stress. I always have. This pain feels different. It doesn't feel like something that would just come from being stressed. It feels real, physical, not just in my head.
I understand. And I know this something to worry about, but we will
Thank you for
make
saying
sure
that.
that, yes, please, yes, listening, yes.
Sorry, I just want to make sure you really understand how much this has been affecting me. It's not just a little worry, it's taking over my life. I can't focus at work, and I'm always scared the pain means something serious is wrong. I just want someone to finally tell me what it is and how to fix it.
I understand. So can I ask you if you have any related things, or is it only the chest pain that you are suffering from?
It's mainly the chest pain that bothers me the most. Sometimes I feel a bit short of breath when the pain is bad, but I think that's just because I get anxious when it happens. Otherwise, I don't really have other symptoms. No dizziness, no fainting, nothing like that. It's really this pain that won't let me live in peace.
Okay, Angel. And when you have this pain, how you react about it? What do you do? How you make it less, or how it is going when you had the attack or when you had the pain itself?
When the pain starts, I usually panic a bit, to be honest. I try to sit down and take deep breaths, but it doesn't always help. Sometimes I press on my chest or change positions, hoping it will go away. I've even gone to A&E a couple of because I was so scared it was a heart attack. Usually after a while it eases off on its own, but I'm left feeling shaky and worried for hours. I just can't relax until I'm sure I'm not about to collapse or something.
And will be there anyone around when you had these things? Like you have a family member? Are you living with someone, or you are alone there?
I live with my husband. He's been supportive, but I think he's getting tired of all the hospital visits and tests. Sometimes he's at work when it happens, so I'm alone. That makes it even scarier. My parents are back in India, so I don't really have other family here. I do have a few friends, but I don't want to bother them every time this happens. Most of the time, it's just me dealing with it.
Okay. And did it affect your work at any time? Are you still attending your work?
Yes, it's affected my work quite a bit. I'm still going in, but it's hard to concentrate when I'm always worried about the pain. Sometimes I have to leave early or take breaks if it gets bad. I know my colleagues have noticed, and I feel embarrassed about it. I just can't help it. My mind keeps going back to what if something's really wrong? It's exhausting trying to keep up appearances.
Yeah, I know this is like a difficult thing to happen. And did you ask the doctors, who you went to physicians? Am I right? Did you ask them what's going on? Did they reassure you, or what happened? How many times you went to a doctor there?
I've lost count of how many times I've seen doctors about this. Every time I go, they do more tests or check my heart, and then they tell me everything looks fine. Some of them try to reassure me, but it never really helps because the pain keeps coming back. I keep thinking, what if they've missed something? What if it's something rare or serious that just doesn't show up on the tests? I just want answers, not just reassurances.
I understand. And how about your other medical issues? Do you have anything like major, like asthma, diabetes, hypertension, anything that you are taking regular medications for?
No, I don't have any major medical problems like that. No asthma, no diabetes, no high blood pressure. I'm not on any regular medication, just the occasional paracetamol if I get a headache. That's why this whole chest pain thing is so confusing and worrying for me. I
Oh,
thought I was healthy before all this started.
uh-huh. And the thing is, did you had anyone from your family that have any psychiatric issue, or he visited or she visited a psychiatrist for any other reason?
No one in my family has had any psychiatric issues that I know of. This is honestly the first time I've ever been sent to a psychiatrist. And it's only because my cardiologist suggested it. I never thought I'd be here. I just want to get to the bottom of these chest pains, not be told it's all in my head.
Yes, I understand you. So you came here after, if I can summarize what's going on, Angel, that you came here after
Yes.
a lot of like you went to a lot of doctors or physicians, and you came here for me to find a solution for your problem. Am I
Yes,
right?
that's right. I've been to so many doctors, had all the tests, and no one can find anything wrong. I was hoping maybe you'd have a different perspective or could help me figure out what's really causing this. I just want to feel normal again and not be so worried all the time.
Yeah, sure. Being normal is so important for your functionality at home and at work. And I think work is a major thing for you. It seems that you are a working woman since a lot of time, yeah?
Yes, work is a big part of my life. I've
All
always
right.
been proud of being able to handle my job and stay organized. But lately, it's become so difficult because of this pain and all the worry. I hate feeling like I'm not performing well or letting people down. It's frustrating because I used to be so reliable, and now I feel like I'm falling behind.
Okay. Do you have any kids?
No, I don't have any children. It's just me and my husband here.
Okay. All right. And this thing have been worrying you for about 1 year.
Yes, it's been about a year now. I can't believe it's
Okay.
gone on this long without any real answers. It's
Oh,
honestly exhausting.
all right. I understand. Um, do you visited the hospital before 1 year for any other reason?
No, not really. Before all this started, I hardly ever needed to go to the hospital or see
Mhm.
doctors. I was generally healthy and didn't have any major problems. This chest pain is the first thing that's made me go back and forth to hospital so much.
All right, Angel. I really understand what's going on, and I think you went through difficult times. Um, from my side, my suggestion is I will see you more frequently. I can see you next week, like once or twice a week, according to your schedule, if it's okay. And also, I will maybe, I think if I let you to talk with a psychologist, it will help. So you can like tell what's going on through your mind. Do you feel that this
I
will
mean,
help
I
a
can
bit?
try.
Yeah?
Honestly, I'm not sure either. I just want to do whatever it takes to get to the bottom of this. If talking to someone helps, I'll give it a chance. But
Yeah,
I still want to make
sure.
sure nothing physical is being missed. That's my main worry.
Yeah, I understand. I believe they did all the
It
tests and the
just
things that they make sure that there is nothing there. Yeah?
That's what they all keep telling me. But it's hard
Mhm.
to believe when the pain is still there. You know, what if there's something rare or something the test just didn't pick up? I just can't stop thinking about it. I want to trust the doctors, but it's difficult when I'm still suffering every day.
I understand. So, sorry, I want to ask you some questions about your appetite and your sleeping. Can you tell me more about your sleeping, please? How you sleep in the last few
My sleep
days? Or Mhm.
my sleep my sleep hasn't been great lately. I find it hard to fall asleep because I keep thinking about the pain and what could be wrong. Even when I do fall asleep, I wake up a lot during the night. Most mornings I wake up feeling tired. and not rested at all. It's just this constant worry that makes it hard to relax.
Okay. And do you feel like, did you take like sleeping pills or something to make you sleep?
No, I haven't taken any sleeping pills. I don't really like the idea of relying on medication unless it's absolutely necessary. Sometimes I try herbal teas or breathing exercises, but honestly, they don't help much when my mind is racing.
Mm. And what about your appetite?
My appetite isn't great these days. Sometimes I feel too anxious to eat properly, especially when the pain is bad. I do try to have regular meals, but there are days when I just don't feel hungry at all. It's not like me. I used to enjoy food, but now I just don't have the same interest.
Can you tell me since when you have this feeling? Is it 1 year or less than that?
It's been mostly over the past year, around the same time the chest pain started. Before that, my appetite and sleep were both normal. It's like everything changed once this pain became part of my life.
Yeah, I understand. Um, um, how you like,
Sorry,
yes?
I just want to feel normal again. I want the pain and the worry to stop so I can get back to my life, my work, and just enjoy things without constantly thinking something terrible is wrong with me. I want answers, or at least something that actually helps, not just being told to relax or that it's in my head.
Yeah, I understand your concerns. Can I ask about smoking and drinking alcohol? Are you smoking?
No, I don't smoke. Never
What?
have. I also
Okay.
don't really drink alcohol, maybe just a glass of wine on special occasions, but that's it. I've always tried to keep healthy habits.
Mm-hmm. Mm-hmm. All right. Um,
Okay,
do you
if there's
have like,
anything else you need
so,
to know,
yes,
just ask. I really
I
hope we can
just,
figure this out.
yeah, I just want to ask you, like, what do you think going on in your situation? Like, what illness do you have, if I ask you?
Honestly,
Yes?
I keep thinking it has to be something with my heart, even though the tests are normal, or maybe something rare that they're missing. Sometimes I worry it could be something like a hidden blockage or a problem with my arteries that just isn't showing up. I just can't accept that this much pain could be caused by stress or anxiety. It feels too real, too physical. I just want someone to find the real cause so I can finally stop worrying.
Mm. And are you still worrying about that, even though the doctors told you the tests are normal?
I do understand that. But it's hard to just stop worrying when the pain is still there every day. If you were in my place, wouldn't you be scared? It's not like
Mm,
I'm making this up. The pain is real. I hear what the doctors say, but my mind keeps going back to what if they've missed something? It's
mm-hmm.
like I can't switch off the fear, no matter how much reassurance I get.
So still the worries come back, although there is a lot of reassurances. Am I right?
Yes, exactly. No matter how many times I'm told everything is fine, the worry just comes back as soon as I feel the pain again. It's like a
Mm,
cycle I can't break. I want to believe the reassurances, but the fear is always there in the background.
mm. And do you frequently check your body like previously before this year? Do you frequently check your body for a sign of illnesses? Because some people do like to go to the hospitals, check their body if they have serious illness or something. Do you have this before?
No, I wasn't like that before. I hardly ever went to the doctor, only for regular checkups or if I was actually unwell. I
Mm,
never used to worry about my health like this. It's only since this chest pain started that I've become so anxious and obsessed with checking if something's wrong. Before that, I was quite relaxed about my health.
I understand. And did all of this affect your relationship with your husband or your family?
Yes, it has. My
Mm.
husband tries to be supportive, but I know it's been hard on him. He worries about me, but I think he's also frustrated because I keep going to doctors and nothing ever changes.
Mm.
Sometimes we argue about it, or he tells me to try not to think about it, which just makes me feel more alone. With my family back in India, I don't tell them everything because I don't want them to worry. But I think they can sense something is wrong. It's just put a lot of strain on everyone.
Mm. And are you still able to do your usual things or daily things that you always do, or you find some difficulties in that?
I can still do most of my daily things, but it's much harder now. I have to push myself to get through work or chores at home because the pain and worry are always there in the back of my mind. Sometimes
Mm.
I avoid going out or meeting friends because I'm scared the pain will start and I'll have to explain myself again. So, yes, I do find it difficult to live the way I used to.
Mm. Do you stop doing some hobbies or some interests because of that?
Yes, I have. I used to enjoy going for walks, meeting friends, and even doing yoga. But now I avoid those things because I'm worried the pain will start or get worse. I just don't feel comfortable or confident enough to do the things I used to like. It's like my whole life has become about managing this pain and the anxiety around it.
Yeah. And have you ever felt like this life is not worth living?
No, I haven't felt like that. I get frustrated and overwhelmed, but I don't
Mm.
think that way. I just want my life to go back to how it was before all this started. I want to feel better, not give up.
So you didn't harm yourself before? You didn't
No,
have
I've
ideas?
never hurt myself. That's not.
Okay. All right. All right.
No,
I
I've never hurt myself. That's.
understand. Okay, Angel,
Yes, that's right. I haven't done anything like.
yeah. Yes, I'm listening.
All right. If you have
Mm.
more.
Yeah, I just
All
want
right.
to ask about your
If there's
mood
anything else you
most
want to.
of yes. If I want to ask about your mood most of the time.
قطع انتهى.
Oh, oh yes.
طيب نفتح الكومنتس فيدباك. اول حاجه سؤال لك انت. How do you think you've done?
Um, والله مم. انا I think انا كان عندي زي لستة كده بتاع تك 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 حاجات كده I tick it، لكن حسيت اني دورت كده في شوية حاجات I'm not sure صراحة. كأني عدت سؤالين كده ما متأكدة.
Okay, Dr. Dana, thank you. And I think you did very well, wallahi. The patient, she is difficult patient. She is focusing on her issue and she wants answers. بس وزي ما قال قبل بروف فتح العليم, these are the most difficult patients to deal with. لكن I think you went through the history systematically very well, and I think so. You have يعني gave your screening questions. You touched all areas you are supposed to touch. I think you did very well, والله. A patient, difficult patient, no doubt.
Thank
Thank
you.
you.
Thank you.
يعني excellent job بالنسبه ليكي انت وبرضه خلف الله قبله. في حاجه مختلفه انه مثلا الليله jump into reassurance بتفاير باك مع العيانه دي ممكن بهيجه زياده. الحاجه دي مثلا شفناها هنا انكاونتر اللي قبله. فانا افتكر انه you've done well انه you're trying to kind of validate the experience, try to understand, try to gather the information rather than jumping into reassurance. Jumping to reassurance sometimes مع العيانين ديل is gonna fire back طوالي لانه ده المزعج
بالضبط.
العيان ذاته.
Yeah,
Absolutely. Yes.
absolutely.
طوالي
That's a very
we'll do our
important
best
thing.
to help you. يعني
Uh,
don't assure her. We'll do our best to help you. بس يعني إنه we'll do our best to help you. لكن you will be very back to normal ولا you are going to be cured والكلام ده طبعا we avoid مع كل البيشنتس الحقيقة. سكيزوفرينيك ولا زي دي سوماتيزيشن ولا هايبوكوندرايسيس ولا الكونفرشن ديس اوردرز، ما بنقول لهم oh no 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 you'll be very well and we'll treat you. لا we'll do our best to help you. بروفة العليم اتفضل.
لا absolutely agree مع ياسر ونقطتك انت الاخيره اللي هو الاكسسيف والاوفر ري اشورنس خاصه لما يكون بريماتور. I'm impressed by this doctor presentation interaction مع المريض. بس عندي ملاحظه لكل الابناء والبنات القاعدات الان انه في السايكاتري في حاجه اسمها history taking ومنتال ستيت examination وفيها ايتمز مرصوصه مع بعض انترناشونالي معروف. عاوز الدكاتره دول يركزوا انه يكونوا سيستماتيك كومبلين هيستوري اوف ذا بريزنت كومبلين يمشوا فيها لانه الواحد if you
exactly.
cover the whole thing ما بتلقى نفسك مضطر انك تقدم ري اشورنس بريماتور والكلام بيكمل. لكن لو مشيت سيستماتيكالي تتذكر انه الهيستوري فيه شنو
فعلا وده الكلام
فيري بيزك الكلام قلت يا عبد الغني انت
لعليا بالضبط. ده كلام قلته لعليا انه you just go systematically من
يس
البيرسونال داتا وتمشي تمشي 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 والبيشنس طبعا مرات هم اللي بيتدخلوا يقول لك I have seen too many doctors and I couldn't find an answer. يعني يسيروك انك عايزين انسر منك انك تقول no you'll be very well. ف avoid ال premature answers ولا ال premature reassurance زي ما قال ياسر والبروف. يس لكن دانا she did well very well والله.
Yes, he did well. He did well.
نعم نعم. any comments مهجة او الترينيز او اي زول تاني لانه we are almost 7 minutes to go. طيب ما دام ما في كومنتس في announcements بسيطة. زي ما قلنا قبل في بداية السيشن الحمد لله this is the last session في الدورة التدريبية السادسة تنتهي 30/6 اللي هو بالنسبة لنا نحن انتهت اليوم 28/6 وبإذن الله حنبتدي from next week الدورة التدريبية السابعة اللي is going to start from July to the end of December coming 6 months. وزي ما قلت الحمد لله وزعنا لجنة التدريب وزعت 29 متدرب داخل السودان وفي متدربين خارج السودان برضو بيحاولوا إن شاء الله برضو يتوفقوا إنه يلتحقوا ب accredited training centers خلال ال6 شهور الجاية. زي ما عارفين احنا عندنا اجتماعات اسبوعيه every Saturday لمجلس الطب النفسي كل اللجان لجنه الامتحانات والبحوث والتدريب مع قاده المجلس بروفيسور فتح العليم وعبد الله عبد الرحمن النائب الرئيس والمقرر. ولاحظنا انه عدد كبير من الترينيز حتى من دفعات قديمه من الدفعه 44 ولا 45 46 48 they did not do a promotion one exam they have to do it وبالتالي كلير المعمل promotion one exam كلهم ديل ما عملوا الثيسز. فالحكايه دي يا اخواننا بليز الناس تهتم بيها لانه والله يعني نحن لما الزول يستنفذ فرصه ويرسلوا له خطاب بتاع انه خلاص طي القيد نحن بنكون متاثرين اكثر من اي زول. لكن ملزمين نمشي بالريجوليشنز ملزمين نطبق الريجوليشنز زي ما طبقناها على ال8 أو 10 لحد حصل لهم طي قيد نطبقها على الناس كلهم. ما هيكون في اي لازم نكون فير. طبقناها على مستر A تطبق على مستر زد برضه. فبليز الناس اول امتحان قادم للبروموشن الناس القدام على الجداد يجلسوا للامتحان القادم بتاع البروموشن. اي امتحانات اطروحات ومهجة معانا وعملوا تايم ديت ليميت فور submitting الثيسز. الناس تقدم الثيسز والجاهز والناس الما جاهزين يحاولوا يخلصوا الثيسز لانه بالذات الناس اللي خلصوا الكلينيكال تريننج بالنسبه لنا نحن التريننج ما يعتبر خلص الا حتى لو الزول مش اشتغل 48 شهر، لو اشتغل 58 شهر وما خلص الثيسيس بنعتبره ما خلص التريننج. كلمة completed the training معناها completed the two parts of the training، ال clinical training plus ال promotion exam، promotion 1 promotion 2. وزمان كان في ستوب اكزام وتنازلنا عنه بسبب الظروف. فبروموشن 2 اللي هو السيسيس. فبليز الناس تخلص السيسيس، الناس اللي ما اختارت تايتل تختاروا، الناس اللي ما عملت بروبوزل تعمل بروبوزل طوالي. من بكره وبعد بكره طوالي الناس تقدم النموذج ورسلناه لناس لجنه النواب، نموذج اكمال الفتره التدريبيه السادسه، وقلنا اي زول يكمل النموذج حتى ما لقى شغل خلال الفتره التدريبيه السادسه في خانه تحت زيرو، مكتوب عليها زيرو كلينيكال تريننج يأشر عليها. في 5 أيام تريننج، في 4 أيام، في 3 أيام. أقل حاجة 3 أيام تريننج وبياخد عليها نسبة، أقل من 3 أيام تريننج ما حياخد عليها. ترسلوها لثلاثة أشخاص قلنا قبل كده، لمقرر لجنة التدريب دكتور خالد، لدكتورة محاسن ولدكتور عماد، لأنه في ناس كثيرين قالوا رسلنا لجهة واحدة لدكتور خالد وما شافها. أحيانا بيكون في ويرك لود، فأي زول يرسل النموذج ده للثلاثة أشخاص ديل، ترسلوا في الواتساب، ترسلوا بالإيميل، وتبر ترسل النموذج. والناس اللي اتدربوا، بعد طوالي يرفقوا معاه البورتفوليو، اللوج بوك عن الفترة التدريبية، والتقرير النهائي بتاع الترينر في اللوج بوك في آخر حاجة في البورتفوليو، في التقرير النهائي اللي بيكتبوا الترينر عن ال6 شهور الماضية ترسلوهم. لأنه الناس اللي يتوزعوا حيتوزعوا هم، لكن لحد خلال أسبوع أو أسبوعين ماكسيمم ما جات الحاجات دي للناس اللي يتوزعوا، يقول لهم لا، حتوقف التدريب لحد ما تجيب لنا اللوج بوك والبورتفوليو وتقرير نهاية الفترة التدريبية من الترينر. فبليز الناس تنشط في القصة دي، عشان حنخلص حسي خلال يومين إن شاء الله حيجيكم نسبة حضور الناس الدورة التدريبية السادسة، نسبة الحضور. وزي ما اتفقنا زمان، أي حضور أقل من 75% لا يعتبر في كل ال6 شهور، أقل من 75% لا يعتبر. أي حضور أثناء السيشن أقل من 75% من مدة السيشن، اللي هو السيشن 120 دقيقة، بنعمله 90 دقيقة لازم حضور. السيشن المرة اللي فاتت كان 60 دقيقة، عملنا كان 70 دقيقة، عملنا الحاضر 50 دقيقة بنعتبره حضور، وهكذا. فعلى حسب الطول السيشن 75% من السيشن. فنتمنى انه الدورة التدريبية السابعة تكون فاتحة خير للجميع، ودي 7 دورة تدريبية ما بعد الحرب. الفترة التدريبية الأولى كانت أول يوليو 2023. فلما نخلص الدورة التدريبية السابعة بيكون عملنا 42 شهر ما بعد الحرب، غير التدريب بتاع الناس اللي قبل الحرب. فبليز يعني دو ات. انا ما عندي حاجه، لو في زول عنده سؤال سريع بنجاوبه له، ولا نقول لكم تصبحوا على خير، ونشكر بروف فتحي العليم، ونشكر ياسر، ونشكر مهجة. لو في زول عنده سؤال طوالي بسرعه.
السلام عليكم يا بوس.
عليكم السلام.
دكتور ندى.
تفضلي يا دكتوره ندى.
أيوة يا دكتور عبد الغني، أنا كنت الفترة التدريبية الخامسة حاضراها كلها، ورسلت لك وانت رديت لي، قلت كنت بتدخلي ب... بنوكيا. أنا آسفة جدا والله، دايرة أعتذر لك، لأنه الشبكة بتطلعني، ولما تطلعني بيدخل باسم التلفون فما بيكون مكتوب اسمي. لكن أنا يعني الدورة التدريبية الخامسة.
نوكيا سيما حاسس احنا في السادسه، الخامسه دي انتهت زمان في السادسه.
أيوة الخامسة بعد أنا ما رسلتها. ليه؟ لأنه أنا كنت منتظرة يعدلوا الحضور بتاعي. أنا ما غايبة ولا يعني محاضرة واحدة اللي كنت غبتها، كنت يوم يعني جاية من سفر، كنت في
الاسم
سواكن
اللي بتخش بيه الثاني شنو؟ الاسم اللي بتخش بيه الثاني شنو؟ غير ندى.
هو نوكيا، هو
ها؟
بيدخل برقم التلفون. الشبكة تكون كعبة يا بوس
رسلي بس
بتطلعني
رسلي لي
ولما تيجي
الحاجه اللي بتدخل وده عبء علينا زياده. كل البارتيسيبانتس عندنا كشوف الحضور
أنا عارفة
هنرجع تاني نشوف لك السيشنز كم سيشن انت حاضراه بنوكيا وقالوا لك ما حاضراه كم سيشن.
أنا ما كنت غايبة ولا سيشن، يعني الدورة التدريبية السادسة دي إلا سيشن واحدة بتاعت كان في عاصفة رملية ما
يوم
قدرت
كم
أدخل.
خليك من العاصفه، يوم كم عشان نشوف الايام اللي انت
قبل
حضرتي وقالوا لك ما حضرتي.
أوكي حاضر.
رسلي لي في الواتساب النوكيا مكتوب عليها شنو النمره اللي بتظهر، عشان لو ظهرت في الليسته بتاعت الحضور نوكيا كده 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 دي انت بنعدلها. لكن لو ما ظهرت النوكيا اللي انت قلتيها، وقبل كده ياسر يا اخواننا 100 مره قال لكم ما في زول يخش بايدنتيتي ما معروفه. ناس بيكتبوا اسماء ما معروفه، ناس بيعملوا نوكيا ما بنعرف منو النوكيا يا اخواننا.
والله
فبليز
يا
بليز
أنا
بليز كل زول يخش
بعتذر ليك
باسمه.
والله.
ما خلاص ارسلي لي في
أوكي
الخاص اسم النوكيا والايام اللي انت قالوا لك ما حضرتي وانت حضرتي باسم النوكيا، واكتبي لي اسم النوكيا ذاته، ما في مشكله، ما بنظلم زول.
أوكي شكرا يا بوس.
مرحبا مرحبا. ما في حاجه ثانيه، في سؤال ثاني ولا حاجه؟
في عثمان رافع يده.
هاي طوالي خش انا عشان ما شايف الشات، تفضل.
أيوة أنا عندي محاضرة واحدة اللي هي كانت يوم 26 مايو. المحاضرة دي تماما الشبكة أبد تدخلني، يعني طول الساعتين أنا بخش والمحاضرة نهائي ما بتدخل معي. اللي هي دي كان فيها كيس
وحدي
برزنتيشن.
وباقي
هي دي,
المحاضرات.
دي يعني كانت
لا
completely out
والباقي
of my hand. دي نهائي
الباقيات
الشبكة.
خليك من دي
الباقي كان في
يا
واحدة بس
عثمان.
زرتها.
الباقيات
هي الباقي كله حضور، يعني الباقي ده كله عندي
ما
حضور
خلاص ما
بس دي.
حتفرق، لانه الرينج
هي
احنا كاتبين ما عندك اي مشكله، ما بتفرق. كاتبين من 95 ل 100%. الحضور من 95 ل 100% بتاخذ الفول مارك، يعني ما لازم 100%.
آه.
ما دام غايب
آه.
واحده ولا اثنين ما حتاثر ان شاء الله، ما بتاثر.
تسلم يا بص.
يديك العافيه ان شاء الله.
السلام عليكم يا بوس.
عليكم السلام.
أنا يوم الدفعة ال50 بس كان عندي غياب يا بوس في شهر واحد، وأنا كنت رفعت الكالندر لأنه كنت شغال ريسيرش ميثودولوجي كورس.
نعم.
فالبروسيس اللي بالنسبة لي هي كلها في شهر واحد تقريبا. الوقت ده كنت فيه يعني متضارب مواعيد المحاضرة مع مواعيد البروجرام بتاعنا هنا في السايكايتري.
غياب كم يوم يا النجومي؟
والله يا بوس تقريبا في 6 محاضرات
ما خلاص
أو
ستة.
5 محاضرات
ايوه
هي.
لكن احنا يا اخواننا ايوه لو غايب زول
أنا
6 محاضرات ولا
رافع
4
الكالندر.
محاضرات ما كويس. ما الزول الكاتب 6 أو 4 محاضرات غايبة، لأنه هو اتاش مع حتة تانية. ما ممكن نقول هو اتاش مع حتة تانية حضور وهنا نقول حضور، مش كده يعني.
بالضبط.
هو الزول بيضحي بالقصة دي، لكن 6 محاضرات ما حتأثر كثير. يمكن لو ما أخذت 1.2 حضور بتاخذ حاجة أقل منها شوية. يعني المهم المحسوب بالنسبة لنا نحن من 75 ل 89، من 89 ل 94، من 95 ل 100، دي كلها عندها نسب هو في المقياس مكتوبة يعني، فبتحقق النسبة إن شاء الله، ما بتكون أقل من 75%.
اتس اوكي. شكرا يا بوس.
الله يديك العافية.
طيب ما في زول تاني افتكر ممكن بعدها
أوكي
ننهي ونتلاقى الاسبوع الجاي
شكرا.
ان شاء الله.
يديكم العافية. شكرا ياسر، شكرا بروف العلي فتح العليم، شكرا موجة في أمان الله.
يلا
شكرا
في
لكل
امان الله.
التلاميذ الحاضرين، يديكم العافية.
شكرا لكم
يديكم
يا بوس،
العافية.
شكرا يا بروف، بارك الله فيكم.
الله يحفظكم.
شكرا لكم.
شكرا. شكرا.
عليكم.